So, good evening, everyone. This is Dr. Sonpal Dagash, ENT and neck surgeon. I want to address one question, few questions that I've got in my comment section in recent videos, previous videos. That in Neet PG 2024, especially after the counseling has been conducted and you are being advised to join in the first round. See, the questions are like that: if they should join your current seat that you have gotten in the first round, or they should do fresh choice filling in the second round. See, as per me, if you are getting a branch of choice and you are getting the institutes that you have pre-decided, like top 5 to 6 institutes that you have pre-decided that if I get this branch in these institutes, I might take, then you must join and later on upgrade in the for the second round. And if later on you can decide that you want to join the upgraded institute in the second round or the current institute, so it's better to join. See, but if you are not getting a branch of choice, there is no option left. You must do fresh choice filling in the second round and later on decide if you are getting or not. And if you are not getting branch of choice even in the second round, then it's quite dicey. It depends on your rank and the number of tries that you have already given in the Neet PG. So if you are very passionate about your branch, that you not able to change your branch of choice at least, then you can play gamble in the mop-up round. But still, it will be better for mid-rankers and above mid-rankers to better settle down in the second round itself after upgradation, because if you are getting branch of choice and little bit institutes here and there, doesn't matter. Actually it doesn't matter, because you think that you will get better institute, better, but it is not like that. You might end up in a worse institute even after upgradation. So it hardly matters if you are getting your top 5 to 6 preferred institute. It hardly matters that even if you get your first preference of choice of institute or not. So because you don't know who people are going to leave the second round their gotten seat or not, are they going to report, are they going to join or leave. So it's quite a gamble for mop-up, but it's safe for above mid-rankers to play that gamble in the mop-up. But for the later rankers, the below the mid-rankers, it's quite a tough choice to play the gamble or to secure at least a seat in second round, because after second round there is no option for upgradation. You have to either settle or join in that your currently gotten seat, or you can do fresh choice filling for the mop-up round, that is third round of All India quota. I'm especially talking about All India quota only, I'm not talking about state quota. So it's like that. And in my previous videos, once again I want to talk about the surgical branches, especially the voice wasn't clear, so I have described the future scopes, the some money aspect, and that order of preference for surgical branches, especially if you are keen to become a surgeon later on. So I have described that. I hope the voice is clear this time, that your choice of preference is clear and there is no doubt. I have been seeing lots of specialists in all surgical branches, and I have talked to many my colleagues, even seniors. I'm seeing many juniors also that are coming up and taking up the branches. And see, if you want to be a surgeon currently in the special, if you are being advised to choose a specialty in Neet PG, your first preference of choice must be general surgery, because it provides you all the MCH options. All the possible MCH options are available in general surgery, so there is no doubt about it. See, either you like or not the abdomen work, the coli, hernia, everything that comes in the abdomen, piles, fissure, you like or not, it doesn't matter. But if you are able to take up general surgery, if your rank gives you that freedom, you must take, because later on you can do MCH in many other branches. So even if you like the subject or not, if you are passionate about surgery, you must take it. See, obs-gynae I'm not talking about, because obs-gynae is at many places females only are preferred. So if you are a male and want to become a obstetrician gynecologist, then it's quite difficult in tier 3 cities and peripheries and all. See some acceptance also coming up, and there is also an acceptance in tier 1 cities. Of course, in major cities there is nothing like that, but still, as a surgeon's mind, if you want to be a surgeon, that like it only provides you like 2-3 varieties of surgeries. Like if you do a hysterectomy, either you do by lap, either you do by vaginal, transabdominal, but then it's like ultimately the goal is hysterectomy. There is no different variety of surgery. Gynec onco is coming up, but still, like surgical oncologists also take up that cases. Gynecologists of course take that oncological cases, but still ultimate goal is always like hysterectomy. Along with that, you do lymph node removal and all. So the variety of surgeries are quite less. And caesarean section, I think earlier some 6 months course after MBBS also was running on caesarean surgeries are not that much difficult. Of course, very important, but still the surgeons feel if you want to get and you want to do operate a variety of surgeries, then it fails to give in. It's quite a simplest of surgeries, and later MCH options if you wanna later for the superficialize are quite less. There is MCH gynec-oncology, but I will say that it's like a subspecialization within the branch itself only. It's not like a superspecialty branch. So first preference will be general surgery. For male, I'm talking about first of all. Then second preference, this I'm not being biased anyway, but I have talked to many, and I have seen at my current place and the previously places that I worked, like orthopedics used to be the first preference, and currently also many people first preference are male surgeons, are first preference is orthopedics. But still, I would say that seeing the saturation level, especially, I'm not bluffing it, it's a ground reality. Like even in a tier 3 city, in small towns also, there are a bunch of orthopedicians operating traumas and all. So if you are really interested in orthopedics, it's not a bad branch, of course, but still you will have to concentrate on a few niche arthroscopy, like knee replacements, like knee replacement, hip replacement, spine surgeries, and you have to further superficialize like in those niche aspects to make a mark. Actually, it's quite very much difficult right now for a fresh surgeon to do the simple trauma cases. Not simple, but see those most common surgeries that are being done under the ortho criteria. So it's quite difficult to make a mark in that. So and I will rate ENT and head neck surgery along with the orthopedics as a second preference for a male surgeon, male enthusiastic surgeon, because ENT and head neck surgery provides you the variety that is quite missing in that orthopedics. The variety that is missing in obs-gynae and ophthalmology. See, ENT and head neck surgery provides you the head and neck whole portion, plus cancers, plus plastic surgery, maxillofacial trauma, skull-based surgeries, anterior skull-based surgery, lateral skull-based surgery, apart from all the basic surgeries that are already being done under the ENT criteria, all the ear surgeries, nose surgeries, and throat surgeries. So later on, and the one of the most important aspect that I have been talking about to rate it equal to orthopedics is because the 4 MCH that are being newly introduced within the branch. So you are eligible for Neet SS in plastic surgery, reconstructive surgery, then MCH surgical oncology, MCH head and neck oncology, and MCH in neurosurgery. So these branches were actually already available, like eligible for ENT and head neck in the central institutes through INA-SS, sorry. But still, Neet SS, the old PGMER was being like it was like we were following the old PGMER criteria. But still, recently in December PGMER 2023, the new criteria that have been released are being applied currently, and the notification that came in that national board site, it confirms that the information bulletin will be similar to 2022 in Neet SS, but still the criteria and all, eligibility criteria and all, will be followed according to the PGMER 2023 notification. So it will remain. So there is no doubt about it that these 4 MCH are eligible or not. They are eligible and they will remain. So with the current application of this, and see, in 2019 and before also, surgical onco and head neck onco is also already a part of ENT head neck, but still other three branches were not eligible through Neet SS especially. So after being introduction of this 4 MCH, I think it evenly balances with the orthopedics as a second choice. It's your preference, whatever you want to choose, because I've been seeing that even in periphery also there is a lack of ENT surgeons. There are a lack of good ENT surgeons, really. And the number of ENT surgeons, you can see, check the number of PG seats, they're also quite less as compared to orthopedics. So saturation in all is not like too much saturated. It's not saturated. Even if you go in the periphery, this is not even near to any saturation. But still, people are unaware of it, and I don't know what's the issue, but still I will rate it equal to orthopedics. Then for third preference, I will give gynec, of course, notch ahead with ophthalmology, because ophthalmology is extremely saturated, and there is not much variety. I will be honest, and I'm not being biased, that of course there is microsurgery and very precise surgeries. I'm not doubting about the surgical skills. It requires a lot of skill, and the learning curve is also high. But still, there is talking about the variety of surgeries. Variety is very less, very less. Like of course, there is MCH and fellowships available in vitreoretinal surgeries, but still the chunk of patients are cataracts only. So you will have to really do lots of hard work for making mark in major cities especially, and even in peripheries also, because it is being it's been very much targeted by government. They have lower down rates in Ayushman cards, all the ACHS, CAPF cards. The cataract surgeries are being categorized in the government criteria. They're not even categorized in the corporate criteria. So the free surgeries are available in the government setups. So for a private setup, of course patients will be there. I'm not doubting about the quantity of patients, because I think amongst all the specialties or the surgical specialties, the most number of surgeries, of course there is no competition to ophthalmology, because lots of incidents of prevalence is too much for cataract, and it won't reduce any soon. It won't reduce. So it's and setups are also quite costly as compared to other surgical branches. The setup is quite difficult. And then so these are my top 5 surgical branches in order: the general surgery, ortho, ENT, and then gynae and then ophthalmology. Talking about difficulty of surgery, difficulty is difficulty I cannot compare like that. But see, even as a specialty, not talking about if you are further specialized in the branch like MCH and all, but talking about just specialty, the simplest surgeries are gynecology. There is no debate about it. Even you can talk the experts in that field also. It's simple. It's not a complex surgery. So it's quite simple. Most difficult, I think, ortho, ENT, and ophthalmology, where you are not just removing the disease, or not just reducing a fracture, not just just removing anything. You are giving something new, and you have to show the results. So it's in ophthalmology, of course, there is no much case of we are not removing any infection and all, but still it's a very complex microsurgery, and you will require lots of hands-on to say that you are expert in that field. So I will rate ortho, ENT, and ophthalmology as the most complex and difficult surgeries, and then general surgery, but it's not that difficult when compared to these branches, and most simplest will be gynecology. For female, I guess, if you want a surgical branch and you want a relaxed lifestyle, then it's ophthalmology the best choice. There is no comparison actually. But if you wanna have thrill and all, ADR rush, and you are quite inclined towards the female, the obs and gynae, then obs will be second choice. And if later on your choice is like a niche, and like you are not quite interested in anything like obs and gynae, and then you don't want hectic schedules and all, and you don't want even ophthalmology because it might not give you that feel, then ENT, general surgery are the choices. And orthopedics, of course, it's a choice, but I don't think rarely anyone can take. So these are the things. And future scopes, I guess all the branches have future scopes right only. I don't doubt in future scopes any branch. It's just that the we have to keep in mind the saturation funda, and that um, in which city you are living, if you are living in the periphery or the tier 1 city. So all the best for the second round, and thanks.